If you're pregnant and struggling with carpal tunnel syndrome and many of its symptoms, including wrist pain, numbness, and tingling, I hope I can help you understand a little bit more about what's going on and how you can improve things for yourself. And as a reminder, this is not medical advice, this is for education and informational purposes only. Make sure you talk to your doctor for further workup. Wrist pain in pregnancy is very common, especially in the third trimester, and can be extremely debilitating and painful. Approximately 35% of pregnant women will have some kind of carpal tunnel syndrome. Now, this is in comparison to 4% of the general population, so something's going on in pregnancy that makes carpal tunnel syndrome more likely. This is especially true in the third trimester. One of the hints of what might be going on is that carpal tunnel syndrome in pregnancy manifests in both wrists, as opposed to just one. Symptoms are well known and well described. Perhaps you're even experiencing some of these yourself at this time. Numbness, tingling, burning pains, sharp and shooting pains, a dull ache, and perhaps you've even woken up in the middle of the night with some of these symptoms. And hopefully by getting a better understanding of what's going on, you can get some better rest soon. So let's look at the anatomy of what's actually going on in the hand. Here we see a picture of the median nerve, which is the nerve that goes through the carpal tunnel. And this is what gets compressed at the carpal tunnel. And as you can see here, the distribution of pain is often in the thumb, the index finger, and the middle finger, and half of the ring finger. And symptoms are sometimes even felt higher up. Now, to get a better sense, let's look a little bit more closely at what's going on here anatomically. As you can see here, this is the carpal ligament, which gets constricted as fluid gets built up during pregnancy. And as a result, the median nerve gets inflamed, and that often results in the pain syndromes that women will often experience during pregnancy. As I mentioned earlier, there's a characteristic distribution of the pain in these fingers, which are shaded darker blue, and you can see a cross-section here of the carpal tunnel. In pregnancy specifically, the problem is excess blood volume and excess fluid retention throughout pregnancy. And here's a list of some of the causes of carpal tunnel syndrome in pregnancy. As I mentioned, blood volume does double in the course of pregnancy. That's why we see more carpal tunnel syndromes, especially towards the end of pregnancy. Fluid retention generally is happening due to hormonal changes, and the carpal tunnel will narrow and you'll get compression of that median nerve. Another possible cause might be that women are sleeping in different positions and maybe their wrists are getting more stressed as they get flexed or extended in unnatural positions during sleep. So definitely another consideration there. In terms of the diagnosis, it's mostly clinical. It's basically the symptoms that I mentioned. You don't necessarily need advanced diagnostic testing to know whether you have carpal tunnel syndrome, and normally it's a clinical diagnosis. If you want to get a little more advanced, you could think about these two physical examination findings. One is called the Phelan test and another is called TINEL sign. The Phelan test is fairly simple. You hold your wrists in this position for approximately 1 minute, and it should replicate some of the symptoms of carpal tunnel syndrome. TINEL sign is tapping on the median nerve at the location of the carpal tunnel and replicating a shock-like sensation that feels somewhat like carpal tunnel syndrome. So those are two things you could do at home to further work yourself up. There's other things you want to consider because not everything that feels like carpal tunnel syndrome is carpal tunnel syndrome. Also consider osteoarthritis, especially which people feel at the base of the thumb. Tendinitis, or an inflammation of the tendons, Raynaud's phenomenon, and other more complex rheumatological conditions. Any good medical workup is going to have what's called a differential diagnosis, where you try to consider more than one cause for your symptoms. You don't always want to jump to conclusions, so carefully examine your symptoms. For a definitive diagnosis, you'll need a nerve conduction study or an electromyography. This is not necessarily needed for most routine cases, especially in pregnancy where the cause is fairly well established. There are risk factors generally for carpal tunnel syndrome, and these also apply during the pregnancy period. So we talked about fluid retention and swelling, but also repetitive tasks. For example, working at a keyboard for many hours a day, wrist injury, falling on your wrist, or some kind of trauma to the wrist can induce carpal tunnel syndrome. Diabetes and hypothyroidism can increase the risk of carpal tunnel syndrome. Others, like gout, excessive alcohol use, smoking, obesity, just being female versus male, going into the menopausal period, which you have similar hormonal changes and fluid changes that can increase your risk of carpal tunnel syndrome. And we do see that carpal tunnel syndrome does run in families, so genetics is probably another variable. Now, break down what you can do in terms of short-term and long-term solutions. In terms of short-term, oftentimes the patient will describe shaking their hand or shaking their wrist in order to feel relief. And this can definitely produce some short-term relief. Also, you can consider stretching the hand gently, both in the deflection and the extension positions. However, this will often also mimic the pain. You can try doing it with fingers as well as the wrist joint. Elevating the hand, which makes sense because you want to decrease the swelling in the wrist. So elevating the hand will bring some of that fluid down, especially if you sleep at night with your hand elevated. That can be especially helpful. Other short-term solutions are ice, pain relief with medications that your doctor is approved of, such as TINEL during the pregnancy period. Gentle massage and yoga have all been studied and do improve symptoms of carpal tunnel. However, these are short-term solutions. And thinking a little bit more in terms of long-term, the main thing is to try to understand and identify and resolve the underlying condition that's actually causing some of the carpal tunnel. So we talked about some of the risk factors. In addition, there are a couple that are modifiable risk factors that you can address during pregnancy. Weight gain is normal during pregnancy. However, if one has had more than average weight gain, that can be a modifiable risk factor. Hypertension during pregnancy is also an issue, so keeping that under control can help with carpal tunnel syndrome. And preeclampsia, which is a complex condition that often develops at the end of pregnancy, can contribute to excessive fluid retention and worsen carpal tunnel syndrome. So you want to, for example, have your blood pressure checked regularly, especially in the last trimester. Now, in terms of other long-term solutions, labor and delivery is a wonderful solution because we know the cause of that fluid retention and that extra blood volume is pregnancy itself. So giving birth to a baby will tend to resolve the issue. However, after giving birth, moms will often have repetitive wrist use in caring for the child. That can often make carpal tunnel syndrome even worse. So you got to be careful about that after pregnancy is over. In general, what one can expect is gradual improvement and resolution after pregnancy. This is not going to happen in a matter of days, but rather weeks to months. In addition, if your carpal tunnel syndromes did start earlier in pregnancy, the recovery from carpal tunnel syndrome is going to take longer. Now, if you look at people who have carpal tunnel syndrome but are not pregnant, they tend to improve a lot slower than women who have carpal tunnel syndrome during pregnancy. Somehow, the pregnancy-induced carpal tunnel syndrome tends to improve faster and to a greater extent than if it's carpal tunnel syndrome not in pregnancy. So that's a good thing. However, with a new pregnancy, symptoms can recur, and they often do recur, due to the various underlying factors I mentioned. Now, the bad news is that 1 year after giving birth, about 50% of women will still have symptoms of carpal tunnel syndrome. And at 3 years, 30% will still have some symptoms. So it is a long recovery for carpal tunnel syndrome. However, if you do focus on the modifiable risk factors and the many other risk factors involved, especially with fluid, inflammation possibly, and weight, carpal tunnel syndrome should also get better as those things get better. Other long-term solutions, long-term meaning more than just a couple of hours, is splinting your wrists in a neutral position, especially at nighttime. And many women will have to do this during the daytime as well as the nighttime, during pregnancy and also after pregnancy. But this is a great solution, and what it does is it keeps the wrist in a neutral position, and therefore that median nerve doesn't get as stressed. It might sound kind of commonsensical, but one of the best things you can do is not putting your wrist in an extreme flexion or extension position, because those will inflame the median nerve. And you want to avoid activities that provoke symptoms. It sounds commonsensical, but sometimes simple solutions are great solutions. An ergonomic keyboard is also a great idea. It also will keep your wrist in a non-provoking position. Keeping your hands warm has also been shown to improve symptoms. Sometimes women will have gloves that they wear that keep their fingertips exposed so that they can do things with their fingers. However, keeping the wrist warmer than average can help with symptom control. Other long-term solutions include oral steroids, steroid injections into the wrist itself, which can produce up to weeks and months of relief, as well as lidocaine injections, a numbing medication that can go into the joint area. Other long-term solutions include surgery if the symptoms are especially severe, persistent, and if you have other accompanying symptoms like hand weakness or muscle loss. You'll need to consult with a surgeon, and this is more of a drastic intervention that is often not done during pregnancy, because during pregnancy we know that the symptoms are going to get better as soon as the baby is born. Here's a closer up image of the surgery, and as you can see here, what the surgeon does is identifies the carpal tunnel, and the transverse carpal ligament is cut. and then the compressed median nerve is relieved of its pressure over time. So again, a drastic intervention there. Here's some references which you can explore in further detail by looking at the video description. And please let me know if you have appreciated and enjoyed this video and learned from it by liking the video. And if you want to see more things like this, please do subscribe and we'll keep you posted. Thank you so much for your support.